get to our General Secretary to take us through the press conference by reading the press statement. We'd love to quickly introduce ourselves. The introduction will go in this manner. We'll call our name, the position we bear within the institution or the association, followed by the entity that we are working for under the Ministry of Health. By the way of introduction, I am Mepen Dolo, the president of the Liberia Association of Nurses and Anesthetists, and Nurses and Anesthetists assigned at Redemption Hospital on Ministry of Health.
My name is Aliyu Perry. The anesthetic assigned at the Liberian Government Hospital in Tokma.
I'm Joseph Estandam Police, nurse anesthetist assigned with CH20 Hospital in McDivie County.
My name is Ernest S. Gué, Secretary General of Liberia Association of Nurses and Anesthetists, and assigned at St. Health Center, Grand Cayman County.
So my name is Augustine Tino Jr. and I'm assigned at the Redemption Day Hospital, Eagle Town, Bushel Island.
My name is Omidayo T.K. Buna, nurse anesthetic assigned at John F. Kennedy Memorial Hospital, JFA.
My name is Joshua Koha, nurse anesthetist assigned at Redemption Hospital, MOH.
Distinguished member of the press, at this junction, we love to acknowledge and welcome our members who have come to create this occasion. And on this note, we'll turn the floor over to our General Secretary, Mrs. Ernest Gué, who will be reading through the press statement on behalf of the Liberia Association of Nurses and Anesthetists, followed by question and answer from the team of journalists.
Thank you so much. Subject: government's failure through the Ministry of Health, CSA, Ministry of Finance to reclassify anesthesia providers and mid-level health workers. The Liberia Association of Nurses and Anesthetists, LANA, is a legal healthcare association that is responsible for advocating for all anesthetists and anesthetists working in government-connected hospitals and private hospitals across the country. We are also charged with the responsibility of collaborating with the Liberia Board for Nursing and Midwifery for the licensure of our members. According to the World Federation of Anesthesiologists and International Federation of Nurse Anesthetists, IFNA, our country is still far below the minimum practice standard, with only 7 nurse anesthetists and 82 licensed nurse anesthetists in the country. And we believe that the urgent need for equitable pay has never been clearer. To meet the minimum International Federation of Nurse Anesthetic Practice standard, our country still needs about 320 additional anesthesia providers. Because of the limited number in country, most of us are working throughout without day off and even on vacations. About 98% of anesthesia services are provided by our members, but we are yet to get fair compensations that aligns with our qualifications and clinical responsibilities. While it's true that there are approximately 4 Liberian physicians who have acquired anesthesian educations and back in the country, the workload still remains huge on our members because some of those physicians are in administrations. Before we proceed to the issue under discussion, let's take a look at the journey to becoming a professional anesthetist and nurse anesthetist. The journey to becoming a professional anesthetist is rigorous and demanding, requiring a total of 12 to 15 years of high school education, followed by an additional 5 years of specialized studies and a year of internship before licensure. Similarly, nurse anesthetists do go through the same 12 to 15 years of high school education, followed by 4 to 5 years of nursing education to become a registered nurse, before proceeding to anesthesia education, which may require 3 to 4 years. It's disheartening to see that despite this extensive training education, this government has failed to establish a fair and standardized pay grade for these essential healthcare professionals and other male health workers. As we don't want to engage in discussions that will undermine the contribution of other medical professionals, it is essential to bring to the public attention that the government's decisions through the Ministry of Health, CSA, and the Ministry of Finance to reclassify about 91 specialized doctors halfway and bring in 37 interim doctors on the payroll, but leaving other specialized healthcare professionals untouched, is a step meant to undermine the peace within the health sector. This is going to lead a divided, task-oriented, and fragmented health sectors rather than a team center. However, it is crucial to respect the unique specialties and services provided by each professional. As specialized nurses and health professionals, we have refused to accept honor compensation for our vital roles, but the government has refused to listen. Currently, our members are experiencing unjustifiable disparities in salaries. For instance, despite having the same qualifications, work hours, tenure, nurse anesthetists and anesthetists in the same institutions are being compensated differently, with salary ranging from $413.35 to $760. Some of our members who have obtained master's degree in teaching at the level of the only anesthesia school in the country are still undercompensated. This inequity is not only demoralizing, but also undermines the vital roles we play in the healthcare system. Since April 2024, we have engaged with government officials to advocate for the reclassification of our members and even proposing a temporary alignment of all anesthesia providers' salaries to $760 and compensating our members who have obtained master's degree to $900 until a fair, comprehensive pay structure can be established by CSA. Unfortunately, our concerns have not been addressed, and we have been met with silence and claims of insufficient funds. But the government has recognized medical doctor specialties. Remember that we aren't asking to be paid doctor's salary, nor year increment, but salary that is currently being offered to some of our colleagues. Sadly, some months back, the government, through the Ministry of Health, deceitfully deceived us by bringing in one Doris, who they claim to have been sent by WHO as a consultant to help create a policy document that could help solve our head that the government wasn't in the know of such work. After such a frustrating news, we wrote the government asking for a way forward, but no listening ears were given. When we noticed that the government has started fiscal year 2025 budget formulations, we left the hospitals for 3 days to help draw government attention to our issues. And the government, through its Deputy Director General of CSA, Mr. Darlington Smith, came along with the CMO, Dr. Catherine Cooper, and told us that the fiscal year 2025 executive budget draft was going to significantly address our issue. Sadly, we only heard of $50 United States increment in our money gross. After such pronouncement, we wrote the government through the Ministry of Health, expressing our frustration and disappointment, and give them 7 working days to have our issue resolved. Otherwise, we were going to strike. In our communication to the government, we brought to their attention that the addition of 50 United States dollars wasn't best approach in solving the issue of disparities. For instance, if an individual is earning $413.35 and another individual is earning $600 US, will the addition of $50 US across the board solve the issue of disparities? Absolutely no. The government's refusal to listen to our concerns left us with nothing but a go-slow action. Our recent go-slow action, initiated on December 12th, aimed to highlight these issues and draw attention to critical role we play in the healthcare system. While we recognize the urgency of the situation, it is disheartening to note that our calls for justice have been overlooked. On the other hand, the government has prioritized resolving issues for physicians and leaving we and other May-level health untouched. Physicians, whose 80 to 95% of surgical work depends on our collaboration, primarily were attended to but left us untouched. They didn't strike as was planned during their press conference only because their issues were somehow attended to. The LNDA leadership told the national government that our role is significant to enhancing their surgeons' job. And the health sector is a very unique sector that calls for teamwork, but the government refused to listen. As we have made decisions to return to work in the next 48 hours, we want to emphasize that while we are committed to our duties, the lack of resolutions on this matter means that some cases may still be referred elsewhere due to the limited number of nurse anesthetists and anesthetists in some facilities. Some resumption of duties will officially commence on Monday, January 6, 2025 at 7 a.m. While some stakeholders may remain insulated from the repercussions of our go-slow action, we have noticed that our actions are only affecting those financially challenged citizens. As we all know, undercompensation may lead to demotivations. Moving forward, we are going to review our members' schedules and make sure it is in line with the international best practicing standards, and we will take a copy to our legal team for onward consultation with the Labor Ministry. We are going to work on the Decent Work Act to help ensure the best labor practices. 48 hours weekly is what required for each employee, and we are going to make sure that our members are bound by these international best practicing standards. We urge stakeholders to recognize the essential contributions of anesthesia providers and other May-level health workers, and to advocate for our rightful compensations, as our decisions to resume is not meant to show our weaknesses. We are returning to hospitals because we have noticed that many of our stakeholders have not been affected by our actions. Our actions have only created challenges for our citizens who are financially challenged. The majority of these stakeholders who have been thinking of resolving our issues are seeking care at private hospitals and even abroad. The total amount required to ensure equitable pay for our members is just $438,200 United States dollars annually. A small price to pay for dedications and expertise that our members bring to the healthcare system. Despite our decision to resume services, we will be informing our partners and the International Federation of Nurse Anesthetists of this critical issue. In closing, we called upon the government to prioritize the compensation of anesthesia providers and our colleagues, male-level health workers, recognizing the essential roles we play in saving lives and supporting the health sector in Liberia. Our doors are open for dialogue with stakeholders who understand our importance and wish to intervene in this critical matter. Thanks for your attention. The Liberia Association of Nurse Anesthetists.
Distinguished members of the press, at this junction, on behalf of the leadership, we would love to appreciate our General Secretary for taking us through the press statement. And on this note, we will turn the floor over to the team of journalists for question and answer.
Yeah, so I'm Francis Boy, and I read for the famous From Africa newspaper. In your conclusion, you called upon the government to prioritize the compensation of you and that of your colleague. So, but you didn't mention any specific element in terms of the government prioritizing your compensation. So why if the government keep ignoring your quest to compensate for the out-of-net salary, what would be your next course of action?
Okay, so the issue of time is something that we don't want to dwell on anymore, because it has been clearly proven that the government don't have, or I'm sorry to say that, we been on go-slow action since the 12th, and I think if you listen to the press statement, we started the whole process. We started like the reawakening of the process since April, and it ended up with a go-slow action. And while we were on go-slow action, or we were out of the hospital, the doctors came in and made a pronouncement of 10 days being given the government to reclassify the health sector, including their specialists. And later on, today we are here. You are not seeing doctors among us, and you are not hearing any concern from doctors over the past period of time. There are 10 days given the government. It last on the 26th of December. They did not come out again to tell the media whether that issue was attended to. So for us, we feel that we are being neglected by this government. Sorry to say, people will consider it a bit political, but it's not political. It's just the reality. So we have just considered, for the sake of the Liberian people that cannot afford to go to private sector or seek care abroad, we are going back to work. While we are working, people who know that we are faced with these challenges will come to call us for a dialogue. If not, we'll continue to work. But mind you, we are going to work strictly in line with the international